I have a really interesting video to look at with you today. We are truly seeing the worst of what a dishonest and incompetent administration is capable of. Dr. Seema Verma was interviewed by Fox News' Martha MacCallum. Now, Dr. Verma is the administrator of the Centers for Medicare and Medicaid Services in the Trump administration and part of the coronavirus task force. She went on Fox News and was asked 6 times by Martha MacCallum very specific questions about the number of tests, ICUs, and ventilators available for coronavirus, okay? Trump has been insisting for weeks anyone who wants a test can get a test. They can't. That's not true. Trump has been saying people who are flying into the country are being tested. No, they're not. They're sometimes just having their temperature taken. Trump says there are more than enough tests. There are not. Trump pretends like our cases numbers are accurate because we're testing so many people. We're not. The numbers aren't accurate. We might have 500,000 people currently infected. And I have to say, this is not praise of anything other than Martha MacCallum in these 5 minutes, okay? It's not praise of Martha in general. It's not praise of Fox News. It's merely Martha MacCallum realized she was being snowed. She does a good job of exposing this Trump robot who can't stop lying and can't answer a single question. So I'm going to play for you a bunch of questions, which essentially ask the same thing. What is the number of actual tests available? What about the ICUs? What about the ventilators? And you will notice how every single time Dr. Seema Verma just talks about something different. And Martha MacCallum tries to bring her back, and Dr. Verma just again answers about something else. When even Fox News hosts have to expose a Trump bot for obvious lies and deception, you know they're being more deceptive and dishonest than usual. Let's get right into it.
My pleasure. How are we doing on these tests? So I remember last week, I believe, Alex Azar, the HHS secretary, said that there would be millions of them out there by the end of the week. Has that happened?
You know, our focus is on making sure that people that need tests can get tests. And so one of the things that's already available is that at every public health laboratory across the nation, these tests are available. What we're working on now is to increase the capacity in the private healthcare system, because most of us, when we go get tests, we don't go to a public health lab. You're used to going to your doctor's office, they order the tests, and that usually is handled through our private healthcare system. And so we've been working with the private system to essentially ramp up so we can make sure that those tests are available.
Our focus is on making sure people who need the test get it. So we're working on capacity at private versus public. It's not an answer. So Martha MacCallum tries again. You promised millions of tests by now, and we don't have them, right, Doc?
So is it true that there are millions of those? It's now almost the end of the week. So has that mark been met that we heard about from Secretary Azar? Because I was at a doctor for something else the other morning and asked, and they said, you know, we can't get them. We've been calling. We called the state. We called here. We can't get our hands on them. And then I heard it from another doctor earlier today with the same story with a patient that she wanted to test, and she tried to get a test for that patient and was unable to do so.
Well, today, one of the things that we did, Dr. Hahn and I hosted a call with over 1,600 representatives from hospitals to work with them around how they can do the testing inside their hospital laboratories. The other thing that we're focused on is preparing the entire healthcare system. Some of the conversations that we've been having with hospitals is making sure that they have.
Again, no answer. Question is, you promised millions of tests. My doctor says they have none. She answers, well, listen, we've been having phone calls with hospital reps about testing in hospitals. We've issued guidance, no tests, no answer. And Martha MacCallum is starting to get irritated. She filibustered there for more than a minute. Eventually, again, Martha MacCallum manages to get a word in and asks another time. And this time she says, well, we have ICU shortages, we have ventilator shortages, we have shortages of equipment to do tests.
Okay, but in terms of actual equipment, we heard Bernie Sanders today, for one, coming out and saying that there's a major shortage of ICU units. We've heard that there's a shortage of ventilators, even swabs and equipment for the actual tests. What's being done about that? And how concerned are you that when these numbers do start to rise, which Dr. Fauci has told us to expect, that there'll be enough ICU units, enough ventilators to help the people who do get sick in this country?
Well, that's why we have an emergency prepared system. We're used to dealing with disasters. If we look at some of the disasters that have happened around hurricanes in Puerto Rico and Florida, there is a system in place to make sure that folks that are on the front lines have the equipment and the supplies that they need.
So are you saying that we
do have enough? One of the things that we're doing at CMS is to have rapid dialogue with healthcare providers. So we're meeting with providers.
Well, we have a system. But the question was about equipment. Oh, but there's no answer to that. We have a system. We have meetings. We have guidance. They have plenty of dialogue and guidance, clearly. But what about the equipment? More filibustering about tests and equipment. Martha comes back in again. And this time, Dr. Seema won't even let her ask again, just talking over Martha MacCallum.
The needs that they have.
Yeah, I understand
the other
that.
thing that we've really focused on
can I just ask you one more time? Will there be
making
enough?
Sure that people understand, hey, before you go into your doctor's office, you can call your doctor on the phone and have a discussion with them. And they can tell you whether you need to come in or not. And that's really important because we don't want to have people have to travel unnecessarily if they're not feeling well.
No, absolutely.
And if they come into a healthcare facility, they could also be putting others at risk.
Martha tried to ask again, and the doctor just said, call your doctor, have a discussion. Eventually, Martha MacCallum gets to ask one more time. And this one is just nuts. Dr. Verma goes directly into saying Trump has been bold and decisive, and check out the look on Martha MacCallum's face. She can't believe it. It's a smirk of disgust as the last big lie is told. And Dr. Verma knew it was a 5-minute interview and this was the last 30 seconds. Praise Trump and avoid answering the question.
Making sure that providers can use telehealth and telemedicine to serve their patients.
We've made that point here quite a bit, and I think it's a very important point to make. But before I let you go, I want to ask you one more time. Are there going to be people in this country who don't get a ventilator if they need one? Are you concerned that the actual physical equipment that is needed to serve the people who will get sick is out there? Can you reassure everyone tonight that there is not a shortage of ventilators or ICU units?
And that's why the president has taken such a bold and decisive action, right? We're not waiting for this to get worse. We're not waiting for this to be a crisis in our healthcare systems. And that's why the mitigation strategies that he announced last night, limiting travel from Europe, not allowing that. We've given travel advisories on cruise ships. That's why we're taking all of this action, because we don't want to put stress on the healthcare system.
Okay, that's not a direct answer to the question, but it sounds like a hope that there won't be enough sick people and we won't run out of ventilators because we have mitigated, and we certainly hope that's the case.
Guys, this was 5 minutes. Martha MacCallum asked 5 times, tried to ask 6 times, was only able to ask 5 times about tests and ventilators and ICUs, and there was not a single factual answer from this Trump bot who it's almost like her software malfunctioned and she just kept repeating the answers to a different, she was working off of a script for a different interview. It didn't matter. She loaded up that script and read it for this interview, and it's dishonest, it's disgusting, and this is nothing other than saying, at least here, Martha MacCallum kept asking and said, those aren't really answers to my questions. What else can we do? They're just not going to be straight with us.